the steward, physician assistant. It's a pleasure to meet you.
Hi.
You're Mike Pike?
Yes, Mike.
And Mike, can you please confirm your date of birth?
January 2nd, 2000.
And how would you like me to address you?
Mike is fine.
Great, I'm going to wash my hands and then we're going to get started. Mike, what brings you to the office today?
I just have a really sore throat.
And when did this begin?
It started last night and it continued this morning.
And have you ever experienced anything like this before?
I had a previous episode maybe when I was a child, but nothing recently.
And have you been around anybody else that's been sick or had similar symptoms?
I've been around my coworkers and my girlfriend, which they've all been sick as well.
All right, and how would you describe your pain?
It's just sore and burning.
And where is it located?
It's localized in the back of my throat.
And does that pain travel anywhere?
No, it does not.
And is there anything that you've done to make the pain better?
Gargling with warm water seems to help with the soreness.
And is there anything that makes it worse?
It does hurt when I swallow foods, and also orange juice does burn.
And have you taken any medication for the pain?
I have taken no medication.
All right, and on a scale of 1 to 10, with 10 being the worst pain, what would you rate it
I
at?
would say about an 8 out of 10.
And have you had any other symptoms with the sore throat?
I've also had a cold.
A cold? All right, Michael, I have a list of questions that I need to ask you. Can you tell me, have you had any recent weight gain or weight loss?
No weight gain or weight loss.
Any change in your appetite? Have you noticed any fatigue?
No.
And have you had fever?
Yes, fever and chills.
Fever and chills. And have you recorded your temperature? Do you know how high it's been?
I have not recorded my temperature.
All right. And have you experienced any night sweats?
No night sweats.
And in regards to your skin, have you had any rashes or itching?
No rashes.
Any bruising or dryness?
No bruising.
Any color changes?
No color changes.
Any suspicious lesions?
No ma'am.
Have you ever had a history of skin cancer? Any changes to your hair or nails? And do you have any tattoos or piercings?
I do not.
In regards to your head, have you experienced any head trauma or noticed any lumps or bumps on your head?
No lumps or bumps.
Any pain or hair loss?
No pain.
And do you wear corrective lenses?
I do not.
So no contacts?
No contacts.
And do you know when your last eye exam was?
About a month ago.
Have you experienced any sensitivity to light?
No sensitivity.
Any blurred vision?
No blurred vision.
Double vision?
No double vision.
Have you noticed any halos or floaters in your eyes?
No floaters.
Any pain or redness?
No.
Have you had any discharge from your eyes or dry eyes?
No discharge.
Excessive tearing?
No.
And have you ever experienced loss of vision?
No loss of vision.
And do you have a history of cataracts or glaucoma?
I do not.
Recent eye infections?
No eye infection.
And in regards to your ears, have you noticed any change in your hearing?
No.
Any ringing in your ears?
No.
Any pain or discharge or recent ear infections?
No ear infections.
And with your nose, have you had any nosebleeds?
No nosebleeds.
Any type of nasal trauma, broken nose?
No broken.
Any nasal discharge or allergies, seasonal allergies?
No.
Has anybody ever told you you have polyps, or have you ever had any type of obstruction to your nasal passageways?
No ma'am.
Do you have any excessive snoring?
I do not.
History of sinus infection?
No sinus infection.
And any loss or change in smell?
No changes in smell.
And with your mouth, have you noticed any problems with your teeth or had any major dental work? And when was your last dental checkup?
I would say about a month ago.
Any history of gum disease?
No gum disease.
Any sores to your tongue?
No sores.
And tell me, with this sore throat that you've been experiencing, have you had hoarseness?
Yes, I have.
You have. And have you had any pain in the mouth, or is it just in the back of the throat?
Nothing.
Just in the back of the throat?
Yeah, it's back of the throat.
Okay, and with your neck, do you have a history of goiters?
I do not.
And have you noticed any swollen glands?
Yes, swollen glands.
And have you had neck pain or any tenderness to your neck?
No tenderness. No pain.
Okay, and have you noticed that you've had any stiffness or loss of motion to your neck?
No loss of motion.
And with your breast, have you noticed any lumps, discharge, or tenderness?
No, I have not.
And have you had any cough or shortness of breath?
No shortness of breath or cough.
Okay. And have you noticed that you've experienced any wheezing?
No wheezing.
Have you ever had a pneumonia or been told you have asthma?
I have not.
And have you ever had flu,
No flu.
emphysema, or COPD?
No ma'am.
And have you ever been exposed to tuberculosis?
I have not.
Have you ever tested positive for tuberculosis? And have you ever had any exposures to any unusual inhalants?
No.
And do you remember when your last last chest x-ray was?
About a month ago.
About a month ago, and it was normal.
About a month ago, normal.
And tell me, do you have a history of chest pain?
I do not.
Have you experienced any palpitations? Ever had a heart attack?
No, ma'am.
Do you ever wake in the middle of the night with shortness of breath?
I do not.
And how many pillows do you sleep on?
One.
One pillow? And do you have a history of high blood pressure?
I do not.
Has anybody ever told you they've heard a heart murmur?
No heart murmur.
Do you have a history of rheumatic fever?
No, ma'am.
And have you noticed any swelling in your feet or your hands?
No swelling.
Have you ever had an electrocardiogram?
No, I have not.
Have you ever had a stress test or an
I
echocardiogram?
have not.
Okay. And with your stomach, have you noticed that you've had any heartburn or stomach pain?
No heartburn.
Do you ever have any difficulty swallowing?
No, ma'am.
And have you had any nausea or vomiting? Do you have a history of stomach ulcers?
No, ma'am.
Have you had any diarrhea or constipation?
No diarrhea.
Have you noticed any increased gas or rumbling sounds in your stomach?
No, ma'am.
And do you have a history of hemorrhoids,
I do not have a history of hemorrhoids.
rectal bleeding? Or have you had any changes in your stool?
No, ma'am.
Have you ever been told you have liver disease or abnormal liver laboratory
I have not.
studies? You've never noticed any yellowing of your skin or jaundice?
No yellowing.
Do you have any intolerance to foods?
I do not.
Frequent belching?
No, ma'am.
Gallstones? And have you ever had a colonoscopy?
I have not.
Okay. Do you have a history of testicular or scrotal masses?
I do not.
And have you ever been had a digital rectal exam?
I have not.
And have you been tested for a prostate-specific antigen?
No, I have not.
Okay. Have you had any changes in your urination?
No urination.
Any sense of burning or urgency? Do you wake at night to urinate?
No, ma'am.
And have you had any hesitancy or noticed any decrease or weakened stream when you urinate?
No,
Have you ever had loss of control of your
I
urine
have not.
and urinary tract infections?
No,
Have you noticed any change in the odor or color of your urine?
no change.
Any discharge from your
No
penis?
discharge.
Any history of kidney stones?
No kidney stones.
No history of kidney disease or hernias?
No.
And are you currently sexually active?
I am sexually active.
And how many partners do you
I have
have?
one partner and my girlfriend.
And do you, your girlfriend, so you prefer females?
Yes, female.
Okay. And do you feel satisfied sexually?
Yes.
Do you have a history of sexually transmitted diseases?
No.
HIV?
No.
Do you use contraceptives?
Yes, I use
You
condoms.
do. And do you have a history of sexual abuse?
No.
Alright. Have you noticed any changes in your libido?
No.
Any history of fertility issues?
No.
In regards to your legs, have you noticed that you've experienced any pain or cramping in your legs when you walk?
No pain or cramping.
Have you had any swelling in your legs?
No, ma'am.
Do you have varicose veins, real prominent veins in your legs?
No.
Have you noticed a change in the temperature in your feet or hands?
No change.
Any history of blood clots?
No, ma'am.
Have you noticed any loss of the hair on your legs?
No loss.
Any change in your skin texture? Any sores on your legs?
No sores.
In regards to your joints and your muscles and your bones, have you experienced any pain or redness or tenderness?
No pain or redness.
Any trauma?
No trauma.
And have you had any stiffness to your joints?
I have had no symptoms.
Have you ever been diagnosed with arthritis or gout?
No, ma'am.
Do you experience backaches? Do you have any limited motion of your joints or your back? Have you ever been told you have scoliosis or kyphosis, that's a curvature of your spine?
I have not.
Any previous fractures?
No previous fractures.
And in regards to any neurological symptoms, have you been experiencing any headaches?
I have not. No headache.
Have you ever had any fainting or dizziness?
No dizziness.
Do you ever feel like the room is spinning around you?
No.
Have you ever lost consciousness?
I have not.
Have you ever had a seizure?
No seizure.
Any difficulty with your coordination? Any weakness in your muscles?
No, ma'am.
Have you noticed any tingling in your hands or feet?
No, ma'am.
Have you ever had a stroke?
I have not.
Any loss of motor control?
No loss.
Any tremors?
No tremors.
And have you noticed any frequency of urination?
I have not.
Any increased thirst or hunger?
No increased thirst.
Have you experienced any intolerance to heat or cold?
No intolerance.
Have you ever been diagnosed with diabetes?
I have not.
Have you ever taken any type of hormone therapy replacement?
No, ma'am.
Do you have excessive sweating?
I do not.
Any change in your glove or shoe size?
No change.
And have you ever been diagnosed with thyroid disease?
I have not.
In regards to any type of bleeding disorders, have you ever been diagnosed with anemia?
I have not.
Any difficulty stopping yourself from bleeding if you get cut?
No, ma'am.
Any easy bruising? Any history of blood transfusions?
No, ma'am.
And from your mental health, have you experienced any anxiety or depression?
No anxiety.
Do you have a sense of nervousness? Has anybody around you told you you have frequent mood changes?
No.
And do you have any problems with your memory? Any loss or any change?
No, ma'am.
Any sleep disturbances?
No.
Any decreased concentration?
No decreased compensation.
Do you have a history of schizophrenia?
I do not.
Hallucinations?
No hallucination.
Drug or alcohol abuse?
No drug or alcohol abuse.
Have you ever been a victim of abuse?
I have not.
Do you have any family history of mental health issues?
I do not.
And have you ever been seen by a counselor in the past for mental
No.
health issues?
No counseling.
And any unexplained physical complaints?
No, ma'am.
So I'd like to review just a few things that we've talked about to make sure that I understand correctly why you're here. Please feel free to correct me if I say anything wrong.
Yes, ma'am.
So you've been having this sore throat that started last night,
Yes, ma'am.
and you woke up with it.
I did.
You have been around coworkers, and your girlfriend has also had similar symptoms.
Yes.
And you describe it as this sore burning type sensation
Yes, ma'am.
that's worse when you swallow, especially things like orange juice
Yes, and foods.
and foods, and it feels better when you gargle with salt water,
Hot water.
hot salt water. Okay. And you noticed that you've had some hoarseness in your voice,
Yes.
and you have had some fever and chills.
I have, yes.
And you rate the pain as an 8 out of 10,
Yes,
and it's located to the back of your throat, and it doesn't travel anywhere else.
It does not radiate.
Okay. And you said you believe that your lymph nodes are swollen in your neck?
Yes, swollen.
All right. But you deny any type of rash or headache?
No rashes or headaches.
And you haven't had any nausea, vomiting, or fatigue?
No, ma'am.
No chest pain or shortness of breath? No wheezing?
No, ma'am.
Change in your bowel or bladder habits? And you haven't had any appetite or weight changes?
0.
Excellent. I'd like to begin with your past medical history,
Okay.
or continue with your past medical history. And have you had any childhood illnesses?
I have not.
And have you experienced any adult illnesses?
No, ma'am.
You don't have a history of diabetes, high blood pressure, cancer, or COPD?
No, ma'am.
Have you had any hospitalizations?
I have not.
Any surgeries?
I had an appendix removed when I was 12 years old.
Okay. And tell me, are you currently up to date with your immunizations?
I rarely see a medical provider unless it is necessary, but I have not had any immunizations since high school.
Okay, all right. So you didn't get your flu shot last year.
No.
You don't remember a recent tetanus shot?
No.
Okay. And since you haven't seen any medical providers recently, you haven't had any type of screening test done?
No.
And are you currently taking any medications, prescription or over the counter?
I am not.
Okay. Do you take any vitamin supplementations? Do you have any allergies to medications?
No allergies.
Any allergies to the environment or foods?
No environmental or food allergies.
Okay. And in regards to your family history, are your parents healthy? Are they ill? Do they have any major medical problems?
Yes, my mother and father are healthy. Yes.
And how about your grandparents?
They are deceased.
They're deceased. And do you know why they passed?
I do not. I do not know
Okay.
what from.
And do you have any siblings?
I have no siblings.
All right. And with your in regards to your social history, you said you have a girlfriend?
Yes.
Is that correct? So you're not married?
Not married.
And have you been in the relationship a while?
Yes.
Do you have any children?
No children.
And do you live alone or do you live with your girlfriend?
I live with my girlfriend.
And do you feel safe in your home?
Yes, I feel safe.
Okay. And you are sexually active?
Yes, sexually active.
And what is your occupation?
Occupation, I am a car mechanic.
And what is your highest level of education completed?
A high school degree.
All right, excellent. Well, we definitely need car mechanics. Now tell me, do you exercise on a regular basis?
I rarely exercise.
You really? And how about, do you have a lot of stressors going on in your life right
No
now?
stressors.
And in regards to safety measures, do you wear your seatbelt when you drive your car?
I do wear my seatbelt.
And if you're on a bicycle, do you use a bike helmet?
Yes.
Do you have smoke detectors in
Yes,
your
I
home?
do have detectors.
And do you smoke?
I do smoke.
And how
yes.
much do you smoke?
I would say about a pack a day for the last, give or take, 5 years.
All right. And do you drink alcohol?
I occasionally drink alcohol on the weekends with my friends, but no binging. No binge drinking.
No binging. How about illicit drug use?
No illicit drug use.
And do you have any religious preferences in regards to your medical treatment?
I do not.
Okay. Well, thank you so much. I'm going to step out for just a moment and speak with my supervising physician, and then we're going to be back in to perform your physical examination, okay? It's a pleasure meeting you. Now that you've completed your patient interview, you're going to turn to your proctor and you're going to give your oral case presentation. This oral case presentation should read something like this. Mike Pike is a 22-year-old Caucasian male with a negative past medical history who presents to the office for evaluation of a one-day history of a sore, burning throat. He has been around coworkers and his girlfriend who are also experiencing similar symptoms. The pain is located to the back of his throat and it does not radiate anywhere. He rates his pain as an 8 out of 10 and states that it's constant. He has been gargling with salt water that helps, but swallowing, especially orange juice, makes the pain worse. He denies a previous history of similar symptoms with the exception of when he was a child. He additionally complains of a fever and it is currently 102 degrees Fahrenheit. He reports cold symptoms, voice hoarseness, and swollen cervical lymph nodes. He denies rashes, headaches, nausea, vomiting, night sweats, fatigue, palpitation, chest pain, shortness of breath, wheezing, change in his bowel or bladder habits, change in his appetite or weight. He denies any history of tuberculosis. His past medical history is negative, and he has not seen a medical provider recently and has not had any immunizations or screening tests. His family history is negative. His social history is significant for a 5-pack year history of smoking. He denies any significant alcohol use and denies illicit drug use. He is single, lives with his girlfriend, denies sexually transmitted disease, domestic violence, rarely exercises, and uses safety measures. His primary diagnosis is acute strep pharyngitis, and the differential diagnoses include upper respiratory infection and mononucleosis.